What if the antibiotic you think is stronger is actually the wrong one for your infection? Every year in the United States, millions of people are prescribed antibiotics. Two of the most common names you may hear are Cefixime and Amoxicillin. Many people assume that one must be better than the other. Maybe one sounds newer. Maybe one sounds stronger. But here is the truth. Antibiotics do not work based on how powerful they sound. They work based on how precisely they target the bacteria causing your infection. So when it comes to Cefixime versus Amoxicillin, the real question is not which one is stronger. The real question is which one is right for you. Let's start with Amoxicillin. This is one of the most commonly prescribed antibiotics in America. It belongs to the penicillin family. Doctors have used it for decades. It works by attacking the outer wall of bacteria. Bacteria need that wall to survive. Without it, they break apart and die. Because of this mechanism, amoxicillin is highly effective against many common bacterial infections. Doctors often prescribe it for ear infections, sinus infections, strep throat, certain types of pneumonia, skin infections, and some urinary tract infections. It is widely available, affordable, and usually well tolerated. For many routine infections, it is considered a first-line treatment. That means it is often the first option doctors try. Now let's look at Cefixime. Cefixime belongs to a different antibiotic group called cephalosporins. Like amoxicillin, it also damages the bacterial cell wall. But its chemical structure is slightly different. That difference matters. Because of its structure, Cefixime can sometimes work against bacteria that have developed resistance to penicillin-type drugs. Doctors may prescribe Cefixime for certain respiratory infections, urinary tract infections, and uncomplicated gonorrhea. It is not usually the first antibiotic doctors reach for in simple cases. Instead, it is often used when resistance is suspected or when another antibiotic has failed. So which one works better? The answer depends entirely on the infection. For example, when it comes to strep throat, amoxicillin is usually the preferred treatment. The bacteria that cause strep throat are still very sensitive to penicillin-based antibiotics. In this case, amoxicillin works extremely well. Cefixime is not typically needed. For most ear infections and sinus infections, amoxicillin is also the first choice. It targets the common bacteria involved and has strong clinical support behind it. Using a broader antibiotic when it is not necessary can increase resistance. That is why doctors prefer to start simple when possible. However, things change when we talk about urinary tract infections. Some bacteria that cause UTIs have developed resistance to amoxicillin. In certain cases, Cefixime may be more effective. But even then, doctors often rely on urine culture results to guide treatment. They do not guess. They look at lab data to see which antibiotic the bacteria are sensitive to. In the case of gonorrhea, Cefixime has been used as a treatment option, especially when other recommended therapies are not available. Amoxicillin is not typically used for this anymore due to resistance. So, in that specific situation, Cefixime is clearly more appropriate. One of the biggest factors in this comparison is antibiotic resistance. Over time, bacteria adapt. They evolve. They learn how to survive. Amoxicillin has been around longer, so some bacteria have developed ways to resist it. That does not mean amoxicillin is weak. It simply means bacteria are constantly changing. Cefixime can sometimes overcome certain resistance mechanisms, but resistance can also develop against Cefixime. This is why no antibiotic remains perfect forever. Doctors must follow updated medical guidelines and local resistance patterns when choosing a treatment. Now let's talk about side effects. Both amoxicillin and Cefixime are generally considered safe when prescribed correctly. Common side effects for both include nausea, diarrhea, stomach discomfort, and mild rash. Most of these symptoms are temporary and resolve after the medication is finished. However, allergic reactions are an important concern. People who are allergic to penicillin should not take amoxicillin. In some cases, these reactions can be serious. Cefixime can also cause allergic reactions, especially in people who are allergic to cephalosporins. Severe side effects are rare but possible with any antibiotic. Both drugs can also disrupt the natural bacteria in your gut, which may lead to diarrhea or, in rare cases, a more serious infection called Clostridioides difficile. Cost and convenience also play a role. Amoxicillin is usually less expensive. It is available in many forms, including capsules, tablets, and liquid suspensions. Most insurance plans cover it easily. Cefixime may be slightly more expensive depending on dosage and brand. In terms of dosing, amoxicillin is often taken 2 or 3 times per day, while cefixime can sometimes be taken once daily. For some patients, fewer doses per day improve adherence, and adherence matters. An antibiotic cannot work properly if it is not taken as directed. Another important factor is spectrum of activity. Amoxicillin is considered a narrower spectrum antibiotic compared to some cephalosporins. This means it targets specific bacteria without affecting too many others. Narrow-spectrum antibiotics are often preferred when appropriate because they reduce the risk of developing resistance and preserve the body's natural bacterial balance. Cefixime has a broader reach against certain bacteria. But broader is not always better. Using a broader antibiotic when it is not needed can contribute to resistance over time. So why do doctors often start with amoxicillin? The answer is simple. It works very well for many common infections. It has decades of research behind it. It is affordable. And it is generally safe. Medical guidelines often recommend starting with the narrowest effective antibiotic. If the infection does not improve, doctors can then switch to another option. Jumping straight to a stronger or broader antibiotic without need is not good medical practice. What happens if the first antibiotic fails? Sometimes symptoms do not improve after a few days. In that case, doctors may reassess the diagnosis. They may order lab tests. They may switch antibiotics. If amoxicillin does not work, cefixime might be considered. But sometimes a completely different antibiotic is needed. The choice depends on the suspected bacteria and the patient's medical history. It is not about guessing. It is about evidence. It is also important to remember that antibiotics do not work for viral infections. They do not treat the common cold. They do not cure the flu. They do not eliminate COVID-19. Taking antibiotics when they are not needed does not speed up recovery. Instead, it increases the risk of resistance and side effects. That is why responsible prescribing is so important. So here is the final verdict. Neither cefixime nor amoxicillin is universally better. Each has strengths. Each has limitations. Amoxicillin is often the first choice for common infections like strep throat, ear infections, and sinus infections. Cefixime is useful for certain resistant infections and specific conditions like uncomplicated gonorrhea. The better antibiotic is the one that matches the specific bacteria causing the infection. The next time you are prescribed an antibiotic, do not ask which one is stronger. Ask whether it is the right one for your diagnosis. Antibiotics are powerful tools, but they must be used carefully. The wrong choice can lead to treatment failure, resistance, and unnecessary risk. The right choice can mean faster recovery and fewer complications. In the end, medicine is not about picking the strongest weapon. It is about choosing the most precise one. And when it comes to cefixime versus amoxicillin, precision is what truly determines which works better.